Good afternoon, everyone. You're welcome to yet another episode of the Yaba Voice webinar. This is a May episode. And for us here in the Federal Neuropsychiatric Hospital, Yaba, Lagos, May is loaded. May, we celebrated the Mother's Day. So for every woman on this call, please hug yourself. You're wonderful. You're special. And you're beautiful. Again, we also celebrated this last week the Mental Health Awareness Week, and it was a time to move our body because we recognize that movement is also very important for our mental health. May also is a Children's Day, and that's why we are talking about this very important discussion this afternoon. So you're welcome from wherever it is that you are joining us from. But before we go into the webinar proper, the medical director as well as the RA of the Yaba Voice, Dr. Olubenga Adekile Owoye, will welcome us formally to this webinar. Over to you, sir.
Good afternoon, everyone. I warmly welcome you to this month's edition of our webinar by Yaba Voice. As you all know, Yaba Voice is a social media platform of Federal Neuropsychiatric Hospital, Yaba, Lagos, for mental health education, advocacy, and community outreach. It is a platform through which the hospital creates awareness and educate the populace on topical mental health issues. Today's topic is depression and suicidality in children and adolescents, the way out. Depression and suicidality is a major public health problem with far-reaching social and emotional consequences. It is estimated that there are currently more than 700,000 suicides per year worldwide. And we know that each suicide profoundly affects many more people, especially children and adolescents. In today's webinar, there are many questions to be addressed. For example, what do we understand by depression and suicidality? What are the risk factors that can lead to depression and suicidality in children and adolescents? And how do we recognize this condition in children and adolescents? And what are the ways out? To address these issues today, are seasoned mental health experts on this platform. Our first speaker for today is Dr. Grace Ijarobe. Dr. Grace Ijarobe is a consultant psychiatric special grade 1 and the head of the Child and Adolescent Mental Health Services Center at the annex of the hospital. He was the first female consultant psychiatrist of the Neuropsychiatric Hospital on the road, Akure in Ondo State. She was the past chairperson, Medical and Dental Consultant Association of Nigeria, MDCAN, of the Federal Neuropsychiatric Hospital, Yaba branch. Currently, she is an examiner with the Faculty of Psychiatry at the National Postgraduate Medical College of Nigeria. Dr. Grace Ijarobe holds international membership of the American Academy of Child and Adolescent Psychiatrists. She is also a member of the Association of Child and Adolescent Psychiatrists in Nigeria, ICAPAN. She's a member of the Nigerian Medical Association, also a member of the International Society for Substance Use Disorder Professional, ISOP. Dr. Ijarobe is a public advocate and speaker on adolescents and children mental health. She is happily married with 3 children. Our second speaker for today is Oluronke Ogini Ajayi. Oluronke Ogini Ajayi is a certified and licensed clinical and abnormal psychologist. She obtained a first degree in psychology with honors from the prestigious Obafemi Awolowo University, Ile-Ife, in Osun State, and had a Master's of Science in Clinical and Abnormal Psychology from the University of South Wales in the United Kingdom. Furtherance to her academic achievements, she is presently a doctoral student in clinical psychology at the Lagos State University, Ojo. Oluronke Ogini is a member of the Nigerian Psychological Association. Is a national and the vice chairperson of the Lagos State chapter of this association, and is an active member of the Nigerian Association of Clinical Psychologists, a local and international member of the International Society of Substance Use Professionals, ISO. Our areas of specialties include managing cases of childhood developmental disorders, which include the autism spectrum disorder, attention deficit hyperactivity disorder, seizures disorders, intellectual disability, to mention but few. In addition, she manages clients with marital challenges, emotional and/or relationship difficulty, as well as work-life imbalance. At this point, and just lest I forget, Roke Ogidi is also married, is happily married with children. Please, at this point, I want you to join me to welcome our speaker for today into our platform. And I want to urge you to kindly relax and listen to our mental health expert as we promise you a rewarding session of today's webinar. Thank you. Over to you, Dr. Kemi Akitoyeshi.
Thank you so very much, the Medical Director, for that arousing welcome and for starting the conversation for us today. And you know, what the Medical Director had said, he had opened the eyes to the fact that suicide is something that is very, very pertinent in our environment. Even before the COVID, though it was worse, but now I think it's even just on the high rise. And gone are the days when we say, what does a child knows? Because it seems like they know more than 100 even at this point in time. And the issue that we're talking about is very, very germane to their emotional development. And so if you know somebody that needs to be here, a school counselor, a guardian, an administrator in a school, or a parent, please just quickly send the link to them. They can still catch up with us here so that they can join this webinar. And then also we are there streaming live on the Facebook page of the Yaba Voice too, Yaba Voice FMPHY, one word, and then they will be able to watch this live and direct as we share very succinct information upon this important topic. Okay, so we're going to go into the conversation. And Dr. Ijarobe will be talking to us on what, again, are we looking at when we start talking about depression and suicidality in children. For me, I don't even know if we would talk about suicidality and depression. Also, depression and suicidality in children, what exactly are we talking about? Over to you, Dr. Ijarobe.
Thank you. Good morning, everyone. My name is Grace, and my young clients call me Dr. Grace. This morning, we're here to talk about depression. I want to thank the hostess for that beautiful introduction into the world of depression. So they say, what do the children know? And indeed, the children of these days, they do know a lot. The children suffer from depression, yes and yes. Why do I say so? Because we see so many of them at the clinic. So here in the hospital is a hospital that has registered over 20,000 children for treatment, and quite a number of these children suffer from depression. So depression is real, and we do see it occur in children. Now, what is depression? Depression is a mood state where the child particularly does not feel happy, is sad, even though there may be no reasons for that sadness. And this mood state persists over quite some weeks. Also, the child may lose, interest in things that the child used to enjoy before, may withdraw from friends, doesn't want to play or associate with family members, may stop playing, may not want to go to school, associate with people, may stop eating, may not want to feed on regular food, may sleep too much or may not sleep enough. Okay, and even though attempts are made by the family to get the child to begin to do these things again, they find that it's futile. They fail persistently. The child just doesn't want to move from that spot. And yes, we've seen it's called so many names in this environment, but this is depression, and any child who is suffering this will need urgent help. We're going to look at what can cause depression in the community and those risk factors that are associated with depression when I come back again. So let me take you right back to the host.
Thank you so very much, Dr. Ijarube, for that. And she answered that burning question in her heart. And is that, can children also suffer from depression? And the answer is yes. Gone are the days when a child doesn't know anything, or when a child is not even expected to be thinking, not think about anything in any way. But now the tide has changed. And it's like the weather is not weathering very well. Maybe that's why, I don't know. She will tell us the cause when we come back to her. But now let's quickly look at it. What the signs and symptoms of depression in children and adolescents? What are they? So how can we know? So we don't just think a child doesn't just want to talk, or a child is just withdrawn for no reason. And sometimes when this happens, you will find parents will say, today you are not eating, say you are proving stubborn. How do we know? This is Oluronke Ajayi. How do we know? What are the things that we would say? Thank you.
Sorry. Thank you, the hostess, for the question, and good afternoon, everyone on the platform. So talking about the signs and symptoms of depression in children and adolescents. Just as depression affects adults, it also affects children, as Dr. Grace already told us. But the symptoms may manifest differently in the younger population. For children and adolescents, there may be persistent sadness. Yes, they may feel sad. Sometimes they have the sense of emptiness. They feel hopeless. And most of the time, this may occur frequently, making them cry. You just see them, just a child sitting, crying or being tearful and all that. And some of them may exhibit irritability, have anger outbursts or hostility, instead of appearing sad like you would normally see in maybe adults or in some children when they are depressed. And then there is loss of interest or pleasure in the things or activities they used to enjoy. This could include their hobbies, could include the sports they are involved in. It could include spending time with friends and family, essentially leading to isolation of themselves from those people, or avoidance of school or extracurricular activities. It could also lead to changes in appetite. Sometimes when you're depressed, they may experience changes in their eating habits, leading to significant weight loss, or some might eat more, leading to weight gain. And then some of them, their sleep patterns can also be affected, leading to either difficulty falling asleep or even staying asleep. Some of them might even be sleeping excessively. And with the sleep affected, obviously, they wake up feeling unrested or unrefreshed in the mornings, feeling sluggish or looking tired, having lacking energy to do anything during the day. So eventually this pattern would have an impact on their cognitive functioning, that's their thought processes, making it hard for them to concentrate in school, to remember things they are taught or they are told at home, or maybe they are told by members of the family, make it difficult for them to plan or even make decisions. So depression can make them express feelings of worthlessness as a result of having issues with their cognitive functioning. It leads to this sense of, oh, I'm worthless. They blame themselves. They feel guilty for no apparent reason. Some of them may even report physical symptoms, like maybe they're having excessive headaches, like they have their headaches today, headaches tomorrow. You're like, what is happening? You've taken medication. So why is this headache not going? So some of them may even tell you, I'm having stomach aches or other unexplained aches and pains in their body. But when medications are even administered, may seem not to alleviate or may keep reoccurring. So let's also know that when depression is left unmanaged, we are prone to say, oh, well, this child will get over it. And just leave her, just leave him. They'll be fine. Only the child is only seeking attention. They'll be better. But when the condition is left that way, it may become severe and essentially leading to the appearance of or the presentation of suicidal thoughts, ideas now making appearance until this child loses all hope and makes attempt to commit suicide or engage in self-harming behavioral patterns like cutting themselves or even burning up themselves, among other things. So it is important to know that not all children or adolescents will exhibit all the symptoms I've mentioned. And this depends on the severity and the durations of the symptoms, which may vary amongst them. Thank you very much.
Thank you.
Back to the
Thank you so very much, Mrs. Ajayi, for that. When she was talking about the symptoms, something came to mind. And when a child tends to eat so much, the child will become fat. And then the child can be bullied, or the child now start having low self-esteem. And it's like a vicious circle that goes round, round, and round. And the child is trying to find his or herself in the midst of all of those things. Again, the low energy, the cognitive issues. And sometimes too, because of the cognitive issues, sometimes they call the child a lodo in school. We're not even understanding what this child is. So this conversation is really, really very important, very needed. Because when a child is not doing well in school and then is referred to as Adolodo, the child's esteem is also bashed. And then the child that is already depressed will become more depressed. And like she has said to us now, depending on the severity and duration, now it also now determines on the symptoms that we'll be looking at. But again, how did we get here? Dr. Grace Darigbe, a child does not know anything. When we were growing, it's only would they give us food. And once we have food, we are okay. Our life is balanced. We watch Dr. Who, Sesame Street, and that is all. So how did we get here? That a child will have non-suicide, we'll be taking up committees. I don't even understand. Dr. Grace, please help explain to us. Thank you so much, ma'am.
Things can cause depression and suicidality in young persons. And beyond just what we think, which is environmental factors, sometimes even innately from the formation of the child, there could have been problem with the formation of the brain. So in our own environment, having children, how many people went for anything, counseling or whatever to have a child? People just got pregnant and had children. And so sometimes the environment of hosting that pregnancy might not have been good enough. There might have been drugs there, like we take herbs in our environment arbitrarily. There might have been substances, things that are not safe for the brain of the child to develop normally. And so that means that as the child is developing, certain things might have happened that makes the brain susceptible to, difficulties in the future. And until the child gets to that point in the future, nobody will know that this child is harboring this kind of problem. There may be difficulties with the pregnancy, infections, and all of that, rashes when the mother was having pregnancy, threatened abortion, even at birth, at delivery, difficulties with delivery. In our environment, we can't say that our postpartum care, our prepartum, postpartum care, or even perinatal area is okay. So it may be that, some injuries, head injury and all that has been suffered while the child was being birthed. And so this child has come in already having some little bits of issues with the brain. Now look at after the child was born, sometimes the child is ill. How many parents take their children to the hospital to be properly treated when they're sick? The child battles with illness. Maybe there's no money to fund hospital bill and all of that. And all these illnesses that children suffer, the way the body suffers is the way the brain also suffers. And so little problems might also have emanated with the brain functioning. As the children grow up into immunizable years, are they fully immunized? Are they protected from those viral infections that can affect the brain? You and I need to answer that question. As they come into the early childhood years and they start school, What is the environment for the child? Is the child nurtured properly? Is the child well fed? Because the child not having enough nutrition for brain growth, the brain grows very rapidly in the first 10 years of life. Is the child nurtured properly so that the brain grows well? All those are things that can cause problems later on in life. If the child is in a family that is problematic, probably the parents are fighting every day, the child is sad, he observes that the father is sad or the mother is sad after they have finished beating each other. The child too is sad. Persistent sadness within the family for this child might lead to depression at a later time in life. Children who are entrapped, the feeling of entrapment is probably one of the greatest consequences for depression and anxiety in children. And so children will live within an environment where they feel trapped within certain very, very unsound situations or very saddening situations, may burn out their brain to the point that they begin to have depression. Or children who have difficulties with school bullying, or they can't, they are not so good with the academics, and the teachers are always threatening them. They'll beat them or things like that. It's a very threatening and entrapment situation, because tomorrow morning child has to go to school again. So those kind of things can force the child's brain into a situation of depression. So many things in the environment can cause depression. As the children go into the teenage years and they begin to get a bit more independence from home, they are far from home and all that, they begin to experiment with the environment. They may experiment with drugs. They may experiment with substances, things that can potentially harm the brain. And so all those things can lead to depression later on in life, or even from point at which they start using some of those substances. They may also begin to experiment with social issues like sex, having boyfriends or having girlfriends, going through heartbreaks, things that, young people have no business going through. And because they are young, they're immature, they're not resilient enough, they emotionally cannot take some of these things that they are now toying with. You find that they are sad persistently for a long period of time, and that may tip them into a depressive state. So children can go into depression. Adults can force children into depression by the way they interact with them. If a teacher is very forceful and very abusive in school, or parents are even abusive at home or negligent, they may cause that child to develop depression at a later time. What about losses? Life is unpredictable. The way people can lose parents, the way people can lose spouses, is the way children can lose their own parents. And so what do the adults do when they have losses? You see other adults come around, they support them, they greet them, they take them out, they try all their best to cheer them up. But what about the children that have also suffered the loss of their parent? The spouse is being cheered by all the neighbors around, but the children are just pushed into the bedroom, or they are just cast aside. Nobody's comforting them. Nobody's talking to them. Nobody's helping them to process their loss at that time. And those things can weigh heavily to the point that at a later date, they may develop depression. So children who are not supported through adversity, children who are cast into adversity, children whose environments are very sad and threatening. Look at the IDP camps in the north. Many of those children are orphaned. They've gone through adversity. They've seen things that even adults should not see. They've seen people being killed, slaughtered, and all of that. And these things weigh on their heart. They process it in their minds day in, day out. And nobody is supporting them emotionally. Nobody is there, to hold their hands or to help them think through what is going on. And so some of those children can go through depression. Many children actually suffer depression without the families knowing, or without people around them knowing about it. It is only when it becomes problematic or is escalated to the point where they're not trying to kill themselves, or do something very punitive to other people around them, that people get up to say, what is going on here? So children do suffer depression. Many things we don't put in our mind as things that can tilt children towards depression can tilt them towards depression. Care from before pregnancy, care through pregnancy, care through the early childhood years, care all the way. Things that a child goes to school and falls from a high story building because there are no fences or there are no balustrades on that building. So care all the way to make sure that these children do not suffer injuries that can make their brain to become susceptible to all these illnesses. I'll take it right back to the host.
Thank you so very much, Dr. Ijarobe. And you know, she said something very succinct. A whole lot of times, mothers get pregnant, but no, we don't care about what happened. The only thing we care about is she's pregnant and she has delivered, and that's all. But there are lots of things to watch out for, but we really don't. And you know, when she was also talking about, I remember that sometimes some of these pills they give us when we are pregnant, then I hate the smell. And a lot of us will not even take it. And they are very necessary for brain development, among other things like that. Maybe, no, and there's so many things that it's now this particular trend that we're seeing about suicidality and depression among this younger generation. Some time ago, my son came and said, "Mommy, you're a psychologist." I said, "Yes." I was even carrying my shoulder that he asked a very big question for a psychologist. I said, "What is the meaning of was self-esteem?" I now told him, he said, "Do you know that what you're doing to me is damaging myself?" And I was like, "Excuse me, because I asked you to go and walk, I'm damaging your self-esteem." And it's like, I got to understand that the way they reason now is so fast and they process things way deeper than how we would process things. And I think that's part of what we're looking at. But then Mrs. Ogini would now be telling us, Ajayi would talking to us on the impact of depression, suicidality on children and their growth, their life generally. So she will be talking to us about that. Over to you.
Thank you once again. So, talking about the impact of depression and suicidality on children and adolescents, we have significant impacts on the psychological well-being and development of those children and adolescents. Some of the areas that are affected could include the academic performance. So with the ability of the young person to concentrate or remember information or complete tasks being impaired, it can lead to a decline in their academic performance. And suicidality can further disrupt the child's ability to focus, to concentrate, to not be distracted by all those different societal ideas or thoughts coming up, and then focus on the schoolwork or participate in educational or extracurricular activities, as most times these thoughts take over the whole of their thought processes. Also, in terms of social relationship, which is another area of impact, as children or adolescents with depression, or when it gets to the severe stage with tendency for suicidality, they withdraw from social interactions. And this leads to the feelings of isolation and loneliness. Suicidality can also strain their relationship with their friends, family members, as these ones do not understand what is going on. And they may start to experience emotions that show that, okay, what the sufferer or what the child or the adolescent is focusing on the suicidal ideations. Some they might verbalize, some they might not. All this they don't understand, they don't know how to help them. So they are always thinking, oh, why can't he just get over it? Is he not getting enough attention already? You don't they overdo him already. So all of these are I expressed emotions, and they may strain the relationship between the family and friends and the child and adolescent suffering from the depression, leading to conflict in the family, leading to misunderstandings and feelings of helplessness among the family members. So parents and caregivers may also experience high levels of stress, strain, and worries about the child's well-being when they know that, okay, this child is suffering from this or suffering from that, sign or symptoms that we've mentioned earlier. More so, the young person's ability to form and maintain healthy relationship can be a problem as a result of this depressive tendencies they have. Then in terms of physical health, I'd earlier mentioned that some of them might come up with recurrent headaches, stomach aches, or other aches and pains in the body. This may lead to changes in their appetite. They may have sleep disturbances, and With suicidal thought and behavior being on the increase, the stress level of this young child or the adolescent may be, on the eyesight and negatively affect their overall physical well-being. In terms of risk-taking behavioral patterns, this is also on the eyesight, because in order to cope with the suicidal tendencies or with the depressive tendencies they have, they might engage in risky behavioral patterns, such as use of substances, such as self-harm, or even unsafe sexual practices as a way to cope negatively with the emotional pain they're experiencing. And the suicidal thoughts can further increase the likelihood of engaging in other self-destructive behavioral and homicidal behavioral patterns too. In terms of developmental delays, untreated depression and suicidality interferes with the child or the adolescent's emotional, cognitive, and social development, impacting their ability to navigate important developmental milestones as they grow and transition appropriately through the ages. And then in terms of self-esteem and self-image, this can be eroded when they have depressive tendencies, when they have suicidal thoughts, or they've even made attempts. It can erode the young person's self-esteem, their sense of the perception, the self-confidence they have about themselves, leading to feelings of worthlessness, leading to feelings of hopelessness, and having long-lasting effects on their sense of worth and confidence. Finally, children and adolescents who experience depression or who have suicidal tendencies are at an increased risk of developing long-term mental health issues when unmanaged, with the depressive episodes reoccurring, leading to more presentation of anxiety disorders and other mood disorders. Thank you very much. Back to the hostess.
Thank you so very much, Mrs. Ajayi. I got a bit scared when she was talking about the impact. When we're talking about the academic impact, it might look like, oh, it's still okay. It's something we can deal with. It's something we can cope with. But going down, and then looking at the long-term impact of a mental health condition, I think that's very scary for me. And I think that's also why we're having this conversation today, so that we can nip it in the bud and then we can find lasting solution. And Dr. Ijarope is going to do that for us today. And it's going to tell us how can we or manage this impact? How can we deal with all of these? I know that you have the statistics. I know you have the data to talk to us about what you have been saying that the child and adolescent unit. The child and adolescent unit is a unit that caters to children and adolescents, a part of the Federal Neuropsychiatric Hospital, Yaba. So you can see that we're doing a lot here in this institution. So how can we manage all of this, ma'am? Over to you.
People feel that when children have mental illness or when other people have mental illness, that thing, once they have it, that's it. They are like wasted people, but that is not true. That is a myth. Many people can recover from a depressive episode. In fact, the younger a child is, the easier it is to recover from a depressive episode. And that is why it's also very important that these people are caught on time, that they are referred on time, they are diagnosed on time, and that they are treated on time. Because if they are taken care of on time, within 2 weeks, a child can come out of depression. Within 4 weeks, a child can be done with it. And they have the capacity to go back to their normal functioning, back to school, back to the academic weight, back to the academic grades, and all of that, and just to how they used to be before. The problem there sometimes is that they are not diagnosed on time because nobody notices this problem or is willing to do something about this problem on time. People don't go to the right places. They take them for counseling here and there. They don't take them to the hospital. They don't see it as a hospital problem. Some parents have stigma about approaching a psychiatric hospital for the treatment of that child, and it should not be. Have mercy on the child and take the child to the appropriate place where that child should be treated. Some people are referred and they don't come. Some children are in school and exhibiting a lot of symptoms, and instead of the teachers to pick it up as depression, they are flogging the children they say they are recalcitrant or they are being difficult. And so children may not come on time, but when children are seen on time, an assessment is done. If the illness is mild, it could be something that they just need some counseling, some support. They are taught certain ways, to manage the symptoms and to be resilient and to come out of and to cope with it. And they resolve spontaneously on their own. If, according to assessment, the illness is more severe, and this patient will need chemical balancing in terms of medications, then that's exactly what they get. They get the kind of chemical balance that is appropriate for that kind of depression and all the kind of symptoms that they are exhibiting. If it's more with sleep, if it's more with noise and all of that, they are given medications to take, and they take these medications. It's not like malaria treatment that is 3 days. These medications are sustained for quite some weeks. And after that, once the child is well, maybe up to 6 months, sometimes it may be discontinued, or up to 1 year, depending on what the circumstances. But know that these chemicals, people have a myth that, it will damage the child's brain, or the child will never be able to get off it, and all of that. But if a child needs that chemical balancing, that's what the child must get for that child to recover from that episode. But there are other things that can be done apart from treatment with just drugs. It's not just drugs alone. The child can be given every other support, like the child can go for psychological counseling. The child may, if they have social welfare issues that are naughty, the child may be assisted to help sort some of those social welfare issues. Sometimes it's financial, sometimes it's food, sometimes it's a place to stay, sometimes it's friends, sometimes it's relationships, sometimes it's difficulty with family life. And all those things, the child's assisted to solve them, so that the child can be more emotionally balanced and settled. Children who are assisted this way respond faster to medications, and they do well. Some children may need to be admitted. Admitted means that they are taken out of circulation into the hospital environment, where there can be better monitoring, better supervision of their treatment, and all of that, because the illness is that severe, or because the child is just dangerous to himself or herself and other people out there. So those children may need to be retained within the hospital for treatment. But once they are well enough, they are returned to their school, they are returned to their functioning, they are aided, and they are actually encouraged to be able to return to full functioning. Some families will say, don't let him wash clothes, don't let him do this, don't let him do that, so that he doesn't get depressed again, don't stress him. But a child that has recovered from depression can take up full active life. Okay, and they don't, taking up that full active life does not mean that they'll be pressured back into depression. No. If a child is actually recovered, they can go back to their steam, and they will still be able to get everything right. So children do recover from depression. Can it occur again? Can a child who has recovered from depression suffer from depression again after some year, after some time? Yes, it can happen. Remember, we talked that there are some things that are already risk in that child. The environment itself is a risk. Some innate things within the child is a risk. Sometimes it's even a family thing, because we know that depression runs in some families. It could be a genetic thing. So if the child comes down with depression again, the child is simply treated again and supported just like before. And all the issues of the current time are also sorted, and they go on with their lives. Children who have suffered depression can go ahead to become champions in life, politicians, doctors, lawyers, engineers, pilots, you name it. They can achieve anything that they want to achieve. It's just that in the midst of all this, they have to be well treated, well chemically balanced, well managed, well supported, and have a good life. I'll take it back to the host.
Thank you, Dr. Ijabe. That was beautiful. Somebody just sent a message to me privately. You will come to that, ma'am. And she said, what's when the child is observed to be depressed and the source is a family, the home environment? What can we do? I will come back but please note that you can send questions directly to the chat box here, and then we will be able to take your questions and answered. The specialists are here, and that's what they had come to do today. So please, you can send your questions directly to the chat box, and then they will be available to answer all the questions. We're looking at how can we now enhance adaptive coping skills that parents can introduce or teach their children and adolescents to be able to function. Because we also know that distresses, imbalances, and a whole lot of other things, challenges, are part of our world. And so a child may not be able to navigate through life, without going through some of those things. So how can a child, navigate all of those things? Mrs. Ajayi, please can you take that for us? Okay.
Thank you once again, dear host. So some of the adaptive coping skills parents and guardians can teach their children and adolescents would include the use of relaxation techniques. One of them being deep breathing exercises. You teach them when depressed, when anxious, when feeling disturbed, or when you know that, oh, this child is restless and not him or herself at that point in time. Teach them slow, deep breaths in through the nose and out through the mouth, counting the times for them, helping them to calm their body and their mind. Okay, grounding techniques with the use of sensory stimulations around them, like using their five senses to focus around them, like maybe noticing the sounds around them, the sights, what the smell, telling them to tell you all of those things. This helps them to calm and keep centered during that period. And then ensuring that you encourage them with affirmations like positive self-talks. I can handle this. I am strong. I am capable. This is just for this period of time. I can get over it. So this helps manage their negative thought patterns and the emotions that follow those. Then also encourage critical thinking and creative solutions to challenges. Let them help themselves by asking open-ended questions like, okay, I've done this way, and I'm not feeling good about the result I'm getting. What else do I think, or what can I do to turn things around? How else can I solve this problem? Is there any other way to look at this? Are there other things I need to look to? Or are there people I need to meet who have gone through this that can help me with this particular problem I'm experiencing? Who can I talk to in the family? Who am I close to? These are things you need to encourage them to go for. Then in terms of helping them with their emotions too, you can help them by teaching them to identify what they are feeling. For instance, maybe they are feeling angry, they are feeling sad or happy or scared. This can be done through discussions with them or use of emotion charts or by role playing. You can also help them to label these emotions, but encourage them to put names to their feelings. For instance, I feel frustrated. So instead of just reacting to the emotions they are feeling, help them give a name to it. Okay, I feel sad. This may help them make sense of what they're experiencing at that time, and then help them manage their emotions by providing strategies to cope with and control these emotions. With the deep breathing exercises, counting 1 to 10 for young children, taking a break from a particular scenario, talking about their feelings with someone they trust, drawing, journaling. These are ways for them to manage their emotions. You also help them to accept negative emotions, letting them know that it is okay to feel this negative emotion because, well, they are normal emotions we all experience, but it is when they are getting to the extreme that it becomes more of a difficulty for them. Emphasize that these feelings are a normal part of life and will pass with time. So this reduces the stigma around negative emotions. Everybody is making it seem like, oh, this is too much. Like, no, you shouldn't be feeling this, you shouldn't be feeling that. No, let them know that it is okay to experience them and promote a healthy emotional outlook from this. And you also foster the emotions more effectively by letting them have a better, when they have a better understanding of the emotions, accepting the emotions, it helps them have better psychological well-being and enjoy their interpersonal relationship with other people that may have been affected and that may have led to conflicts and misunderstandings in the past. Then there's also the encouraging them to have open and honest expressions of those thoughts and feelings, listening actively and without judgment to them, helping them in terms of self-care, teach them the importance of taking care of themselves physically, either by eating elderly or having healthy meals, rather, eating balanced diets, engaging in exercises, emotions through the relaxation, through fun activities, their hobbies, engaging them in hobbies that bring about happy emotions, bring about, beautiful emotions that wouldn't make them feel all depressed. And then mentally taking them through positive self-talk, positive thinking, and this helps with the mental well-being, the psychological well-being of the child and the adolescent in question. So as parent and caregiver also, you also need to encourage reaching out to trusted adults, friends, family members, even if they're teenagers and they feel, oh, I'm just a loner. I'm the only one just experiencing this. I feel so isolated. I feel so lonely. Let them know that there are support groups that they can join when needed. Teaching that asking for help is a sign of strength and not a weakness. It is okay to cry when needed. And then also encourage creative outlets like expressive therapy, use of music, engaging in artistic expressions, writing to express their emotions or feelings in a positive way, and also teaching them kindness to themselves, to other people, ensuring that they understand the feelings of other people, and this helps them to accept themselves, accept the emotions of other people as well, just as they would call those people close friends, just in order to encourage a deeper interpersonal relationship with other people. And then in terms of resilience, you encourage learning from failures. We all learn one or two things from failures. And when we correct these things, then we are able to be successful at whatever it is we are doing. So help them to learn from their failures, help them to be persistent and be able to adapt to situations around them, teaching them that mistakes are opportunities for growth, for them to learn more and be better at what they do. And also encourage setting of limits and prioritizing self-care, teaching that saying no is okay. You don't have to say no all the time. And this is sometimes necessary for your own mental wellness. So with these coping skills taught to them to manage their challenges, whenever you as a parent, as a guardian, or even as a teacher who is, into the care of those children and adults and feel that, okay, I'm overwhelmed, I don't think I can manage this properly, please do not hesitate to reach out to mental health professionals for proper management of whatever signs and symptoms you've seen in the children and adolescents. Thank you very much. Back to the host.
Wow, wow, wow. Thank you so very much. That was succinct. That was well said. A lot was just going on in my head. I wouldn't have to go back to look at this or to listen after that, because Mr. Ajayi had read out quite a lot of things that we can do, teaching them to understand their failure. But incidentally, we are the ones that will now teach them that they are failed. That means they are a failure in life. We'll begin to make them to look at other colleagues and say, oh, you have failed. See your mate, see your friends, see your, it's a whole mumble jumble of things. And that's why I would come back to you with another question of, if now parents are the ones using words, negative words and comment, how do a child thrive in such an environment? Now, Dr. Jarugbe, somebody just asked a question on the platform, and that is, can somebody be depressed without knowing? And then please link it up with the earlier question I asked, when parents are the source of pressure and other things like that, and this child is repeatedly coming to the hospital, self-harming, hurting self and other things. What can we do? Over to you, ma'am.
Okay, so can someone have depression without knowing? That is very true. And how can that be? Because many people do not have a knowledge about how depression runs on people or how people feel when they are depressed. So people can have clear-cut symptoms of depression and they're not able to put it together that this is what is going on. They just feel that they are sad, but they just can't explain it. Or maybe in our environment, we can explain it away by witches and wizards. Or, you know, something in the atmosphere or in the air bothering me and all of that. And so screening is important. Sometimes, I think these days now we're beginning to have maybe some workplace screening and all of that. Screening means that, you know, certain forms are given, people fill it, and then it helps us identify that this person has an issue. But even then, stigma will not allow some people to fill such forms. And people may run away on form filling days because they don't want people to identify that they may have mental issues or mental health issues. So we have some difficulties in our environment when it comes to identifying people who have this. But now you have listened. And that means that if you think back to somebody in your office, somebody at work, somebody in school, somebody in your classroom, if you're a teacher, you should be able to put it together now that at least have a suspicion that maybe this person could have this, and this person needs to visit the hospital so that if this is what it is, this person can get help. Because depression, as simple as people think it is, can lead to death. People wake up one day and somebody has hung themselves, somebody has jumped into the lagoon, somebody has drunk rat poison and all of that, and then it is too late. So now that the person is still alive, is the best time to help the person determine to get help. The next thing that I have to deal with is if the source of the depression is within the family that is supposed to take care of the child. There's something we call complex trauma. And that means that it is trauma coming from people who are supposed to be the people who are giving love and care to the child. And it's not as uncommon as you think. In fact, so many children that we meet in the clinics have complex trauma. They are being traumatized by family, sometimes by relatives, and the parents think, oh, we're loving, we provide everything, but they have relatives they are harboring in the house, and when they go out to work, those relatives kind of deal with those children in ways that they will not treat their children. Sometimes it's a house help, sometimes another help that they have gotten, and they think those helps are taking care of the children. So it's good to talk to the children to be sure that the people you have invited into your home to live with you are not traumatizing your children, because now the children are in entrapment situation where they are within their own homes. They cannot escape. They are in their houses, and the whole setup within the house is made uncomfortable for the child. It could also be that it's the parents themselves that are harming the child with their words, with their cruelty, with the things they're doing, with abuse, persistent beating, you know, telling the child very, very negative things, comparing the child with others, or, you know, being extremely punitive for every little thing that the child does. So the child is hyper aware, always in a state of tension, fear. You know, they're using up all the brain chemicals all the time from this fear in the environment. And because the parents are always present within the home, this fear does not abate, this anxiety does not abate, this tension does not abate for the child. And so that child could become depressed. So what can be done? Where we take some of this information from the hospital at times and the clinic, we're able to identify that the entrapment zone is the school, or the entrapment zone is the family. And I don't mean the house or the luxurious building. Family are the people that live there. In short, sometimes the entrapment zone might even be on the streets, because we have people who are street children and their fathers are the area fathers, their mothers are the area mothers, you know. They have their own kind of family, you know. So if that family is an entrapment zone for that child, we may invite them in, you know, in terms of therapy. So therapy for this child would include the family. And that would be educating the family what to do with the child, educating the family that whatever it is that's going on in the family is creating problem for this child. And therefore, they must make effort to resolve whatever it is. If it's conflict between spouse, they can go in for couple therapy and all of that. If it's conflict between siblings and other people, and all of that, they should try and resolve. They actually go into full-time therapy, and so that the family can be more comfortable for the child. Think about it. The child is always within the purview of an adult 24/7. In the morning, they go to school, they are with their teachers, and they come back to you, they're at home, So this environment, if they are not conducive, the child can actually not escape. So every attempt is made to make sure that the family is comfortable. Sometimes in therapy, what if therapy fails and the family fails to resolve and all of that? Well, that's very tough for the children, because in this environment, we don't have so many facilities that we can use to withdraw a child to a more convenient home or a more conducive environment, or to foster after a more conducive family. Most of those things are not readily available in the environment. So most children are forced to stay within the purview of the difficult family, and it's really, really difficult. I take it right back to the host.
Dr. Itarube, I just love you. Thank you so very much. That was really, really succinct. I know she had just she saw into my questions, and then she answered everything. But one thing she had said, and I think it's so resonated so well with me, is the fact that she said that feeling of entrapment. And if we do not take care of it, you would find out that a child will not have a safe space anywhere. A child will not have a safe space where they can get life, and function and do so very well. Thank you so very, very well. Very much, ma'am. Olubenga Koka said, we create an illusion of happily ever after. If that's all we let them watch, things don't necessarily end the way we planned sometimes. And children should grow old to be okay with that. Thank you so very much for that contribution. That was very succinct, very, very succinct. And we know that really life is full of challenges, but are not oftentimes roses that we want it to be. There are tons there, even on roses. But I want to quickly ask Mrs. Ajayi, now, peradventure, an individual is able to navigate through life, grow, function. Yes, one way or the other, just find a way. There's this thing that is with us as human. We just struggle, and then we're there. But are there a future as an adult? Does it have implication on how well you're able to function and do well? There are still questions coming in, so quickly just answer that so we can still attend to one or two questions there. Okay, maybe you could just take it on with what is the effect of bad marriage on the children, especially when their mother is being abused physically. Thank you.
Thank you so much. All right, so the first question says, as adults, what are the patterns that shows that this person has experienced depression while growing? Now, you would see some people who present with low self-esteem. They are easily cowed, in quotes, like when you're involved in activities, maybe at work, maybe in the family, and then someone does something that triggers this memory of depression they had while they were growing. Then you see that in no time they start to withdraw to themselves once again. They withdraw, they isolate themselves. They isolate themselves from the family. If they are married, they isolate themselves from the spouse or from the children. Okay, so this could affect them in terms of family. It could affect them in terms of work productivity. It could affect them as a mother or as a father. It could affect them in various facets of life, if not well managed as a child or as an adolescent. And even if well managed, with the environment being toxic for them, it could trigger again the presentations of depressive episodes or symptoms. Now, in terms of the other question now of what the effect of depression on bad marriage is for the children.
No, the effect of bad marriage on the children, especially when their mother is being abused physically.
Okay, so the effect is actually tremendous. Like Dr. Ijari already talked about the toxic home environment. Now, a child observing the mother being beaten day in, day out, not knowing how to help the mother, not knowing what to do to help the mother escape such a situation, would in no time start to possibly, even a male or even sometimes females, they start to have anger outbursts. We talked about irritability as some of the signs of depression in some children. So some of them come up with irritability, anger. They're easily triggered to be frustrated, and in no time they start exhibiting either verbal or physical aggression to them, to people around them, to their schoolmate or people around their environment. Sometimes you see them also isolate themselves. They don't want to relate with anybody, or you tell them, talk, Shana, what happened to you? What is happening? Why won't you talk to us? The child will just keep mute and won't give you a particular response to why they are withdrawn to themselves. It is basically as a result of what they're observing day in, day out in their home, in the toxic home environment. And when this is left unmanaged, when the cause of this isolation, this social isolation, or this feelings of loneliness for the child, or the anger outburst, or even the persistent sadness, when it's left unmanaged, then it can become more. Then we talked about the severity. It could lead to something that's supposed to be mild and quickly managed, maybe like counseling, leading to a moderate level of depression, leading to severe and profound levels of depressive tendencies later on as they grow. So I think this covers the
Thank you
questions
so very
asked
much.
by
We do
this.
not have time. That's our major problem here on Yaba Voice. We have so much information, especially from our experts, but just time. Yes, the International Center for Community Peace. Yes, we would make the recording available. It's on the YouTube page of the Yaba Voice, FMPHY. Yaba Voice, FMPH1Y, one word. Please just go there. You will see this recording as well as previous episodes of the Yaba Voice recording. You will be able to access this and listen to it. Thank you so very much, everyone that have been on this call today. We'll take the last word from our speakers today. Dr. Ijarube, one last word, 30 seconds.
So what do I have to tell the community about children suffering depression? Children do suffer a lot. Children suffer just as much as adults suffer. Children suffer pain. Children suffer emotional turmoil. Children are afraid when they can't pay their school fees. Children are afraid when they can't feed. They're afraid when their parents are in pain. Children are afraid when so many things are going wrong. And the community needs to become more and more sensitive to this. If you find a child who's not doing well, the first response should not be punishment. The first response must always be to find out what is the issue with the child. Because now you may find something that you can help the child with. But if, like we normally do in our environment, the first response is punishment. For every disobedience, punishment for not doing well, punishment for not, holding the stakes and all of that, then this child will continue to be pushed down to the point that the child may deteriorate to very, very unsavory conditions. However you do it out there, make sure the child is safe, make sure the child's environment is safe, make sure that the child is watched out for. Children come under the purview and care of all of us in the community. Just make sure we all take care of this child and the children will do better. Thank you.
Thank you so very much. Children also go through a lot. Please understand it. Make the environment safe for them. And then we will be able to deal with this conversation adequately that we're talking about today. Mrs. Ajayi, one last word.
Thank you so much for having me. So I would say that to develop resilience, to develop self-confidence, to help with the sense of what and a positive outlook in those children and the adolescents, to help them prepare for life challenges and opportunities, parents, guardians, teachers must always look out for them. You must always look out for them and be ready to teach them adaptive coping skills, which would help them eliminate, tendencies to experience this depressive symptoms we've talked about, and then when this at the severe level, to suicidality. All of this being put in mind by the parents, by the guardians, by everyone surrounded the children. It's a community care. It's more of a codependence thing. When the child is well, the family is well. But when the child is unwell, the mother, the father, they're all strained, they're all stressed because they need to take care of the well-being of the child. So when all of this are being looked out for, there with the adaptive skills in place and the knowledge of where to seek expert care in place as well, then we can always help those children to be able to cope and to help eliminate the present tendencies as suicidality. Thank you very much.
Thank you so very much. The YouTube page of the Yaba Voice is Yaba Voice FMPHY. Federal Neuropsychiatric Hospital. So it's shortened, Yaba Voice FMPHY. Please go there. You will see previous episodes. Yaba Voice has been running for the past 3.5 years or 3 years plus. They're about now. So we have very many information for you. So please, you could access any of our previous. Yes, you just joined late, but you're welcome. Please just hurry up to the Yaba Voice. And then I want to make a very passionate appeal. Please, once you get to the Yaba Voice YouTube page, please subscribe. Now it increases our people will be able to see us more. So please subscribe, and it's free. That's beautiful. It's free. We are not asking you to pay money to be able to do anything. Yaba Voice FMPHY. That's the YouTube page of the Yaba Voice. And so you could access. Please subscribe. Our visibility will be ensured when you subscribe, so that more people will be able to see, and then they'll be able to get this information that you are also getting. And then we'll be able to do the world a lot more good. And then next month, by the grace of God, the month of June, we have something very big coming. Let me share with you. What we're looking at next month is drug abuse, a pandemic for urgent attention. I will tell you that if we must act, then it is now. Drug abuse is something that we will really, really need to be able to all rise up and walk about. Next month, we'll be having a very robust conversation on that. And we'll be bringing in seasoned expert who will do justice to that conversation. So please mark the date, the third Thursday in the month of June. By the grace of God, we will be here talking about this topic that we had just share with you. And so on this final note, I want to say thank you to everyone, to our speakers who had shared with us so brilliantly on this important topic for today. I also want to appreciate everyone who, not every month, they're always here, coming in and joining us. Thank you so very much. Please hurry up to our Facebook page, our Instagram pages, and share, like. Just let's know that you are blessed with what we are doing. We would appreciate that. And on this final note, on behalf of the medical director and the arrowhead of the Yaba Voice, Dr. Olubenga Adekile Oweye, I would say thank you so very much on behalf of everyone also who is a member of the Yaba Voice team. Thank you so very much for being on this call with us. We quite appreciate you. And please keep flourishing. Ensure that the environment of the child is made peaceful, structured in such a way that the child will be able to grow adequately and ensure growth in all areas. So thank you very much. Until we come your way. Bye.
Bye-bye.
Thank you.
Bye.